Hey guys, welcome back to the channel. Today we're going to talk about something that affects a lot of younger athletes. It's quite a pain to go through. It can linger for quite a long time, even though it potentially doesn't have to. That is Osgood Schlatter Disease. So one of the things we see with Osgood Schlatter Disease is we think of it as growing pains. So for most people who don't know, Osgood Schlatter Disease affects the base of the knee. So there's the tibia, the shin bone. We have this bump at the front of the knee, or just under the kneecap, where the tendon, the patella tendon, attaches from the kneecap to the shin. It's a very strong tendon. When we're younger, the insertion of that isn't pure solid bone to begin with. It's more of a softer bone, a cartilage. And as we get older, as we grow, that becomes hardened bone. But what we see in a lot of athletes, and I had this myself when I was younger, on both knees, what it often is characterized by is a bump at the shin, the top of the shin. So what I want to talk about today is that there's a lot of missing information about this. So in terms of what we find clinically, what I find clinically, there's a very, very, very strong link between Osgood Schlatter disease and back dysfunction. And for some reason, we just don't seem to talk about it, either because we're not necessarily aware of it. If we are, we don't focus on it enough. We talk about core strength, we do those sorts of things, but without realizing it, it may not necessarily be addressing the underlying cause of Osgood Schlatter disease. So our abilities to get rid of it quickly and to stop it from coming back are compromised because we're not focusing on potentially the back's role in setting this up for dysfunction. So like a lot of spinal related dysfunction, it often doesn't seem like it fits because obviously the knee's all the way down here, the back's all the way down here, and there often doesn't seem to be a strong, obvious and tangible connection between those 2 points. But what I wanted to talk about today is that connection, because having had it myself and seeing a lot of patients with the same issues struggling over potentially a number of years, not being able to be athletic and do what they want to do in pain, being in pain all the time, we can potentially get rid of a lot of those cases a lot faster than we have been just by looking at things slightly differently than what we have been. So traditionally with Osgood Schlatters, as I said, we think of it as growing pains. So we think that because you're growing, you have a growth plate, it's vulnerable to overload, and then that becomes irritated and annoyed, and then it becomes painful. And we often talk about it as a self-limiting issue because it's not necessarily an injury in the classic sense we've torn a muscle, but it's an area that becomes tender and sore. And if you can push through it, we always advise that you don't, but if you've got some important things to do, it's not necessarily the end of the world if you do that. But again, there can always be ramifications if you're not careful. But for me, the way we look at this is we look at this as a knee issue first, and we shouldn't. We should definitely respect that it's a knee issue, but if we're not looking at the lower back's role in this, as I said before, we're potentially missing the point of everything together. So again, you'll often see the strip of tape around the knee. We often talk about quad strengthening, trying to support the knee, unload the knee. We talk about rest, we talk about icing. There's a few things that are becoming a bit outdated, but there's still common practice. So for those watching, I just want to talk about some high level concepts that hopefully you can use to short circuit your pain or your kid's pain and get back quicker. So how it all relates together. So what we see, or at least what I see clinically, is any patient who has Osgood Schlatters, what you'll often find is if you get them to sit up nice and tall and then relax. So again, remember, I've had this before. I'm not sure if you can see this really well. So I've had this, so hopefully be able to see a whole bunch of reasons why that is. So if I let myself drop down, what you'll find is there's often a specific hinge somewhere in their spine where instead of it being nice and straight or even just globally curved, there's often a spot, like a sharper point of the curve. And for me, it's around here, basically. I don't know if you can sort of see that. But this area through here is a hot spot for me. Now, what happens with that is as you drop into that position, you start to overload a part of the back. The sharpest point of the curve equates to the amount of load that's going through your back, more so in that area. If you had a broomstick or whatever kind of stick you had, if you held it at both ends and bent it, wherever the sharpest point of that curve is most likely to break. Now, obviously, we're more robust than that, but it's a lesson in that areas of high sort of overload or areas that are dysfunctionally overloaded a lot often become dysfunctional themselves to cope with those positions. So naturally, when we're in a bit of a slouchy posture, that comes with something. So we're either reading, we're on our phones, we're using computers, we're sitting, we're watching TV, we're at work, whatever it is. If you're a student, you're studying, or whatever it is. It doesn't matter what you're doing. It more matters that the position that you're in is most likely poor, for want of a better phrase. So, and what happens is that area is really important because it's this section of the back. So the lower back, where the lower back meets the base of the rib cage, that junction, that thoracolumbar junction, where your rib cage meets your lower back, is crucial because there's a lot of nerves from that area and below that connect to your knee. So from a mechanical point, there's a nerve called your femoral nerve that comes from your sort of the upper reaches of your lower back, in and around that junction, comes out your back, it goes down through the front of your thigh, and it supplies a lot of your thigh. What we find is if you become stiff in that section, so if there's a hinge in your back that becomes stiff, what it can do is it can essentially pull a lot of the slack, whether it be neural tension, whether it just be creating muscular tightness, that creates this extra pull, this extra resting load on your kneecap, and then via your tendon. So just day-to-day life, that tendon is potentially under more load, resting load than it needs to be. And then over time, if you're using that, where you're running, you're being active, you're having fun, very, very easy for this to become problematic. So the way that we've looked at this for a long time is that we've said, well, look, you've done too much, you've been growing, it hasn't tolerated that, but we've neglected to realize that using your knee is normal. You're supposed to use your knee, that's why we have a knee. Growing is also normal, you're supposed to grow, everyone grows. And yet we sort of link these two concepts together and say, well, if you're growing and you use your knees, it's okay if they get sore, it makes sense. But because a lot of this mechanical compensation is hidden, it's not painful, it's just an increase in tension, it's just the mechanics are off. We fail to see that there's a genuine cause that sort of short circuits both of those two normal things. You know, you're allowed to run and jump and play, you're allowed to use your knee, you're allowed to get older and grow. They're basic concepts. So, but it's not so much, as I said, it's not so much that you've been using your knee, you know, hard surfaces, shoes, whatever it is, that's created this overload, is that you're loading an area that's already dysfunctionally loaded, potentially because of the lower back, that mid to low back. So what we can find is if we spend some time trying to free up the back, getting it moving better, de-stiffen some of those stiff segments, whether it be through manual therapy with your physical therapist, or whether it's at home with a lacrosse ball or a foam roller, just having a roller in that spot and arching backwards over that, not rolling around, but just staying there, keeping some constant pressure there, biasing one side to see which side feels the stiffest, the same thing with the ball. Mobilizing that tissue starts to feed more slack back into the knee. And the more of that you can do, the faster those symptoms should settle down because you're improving the environment that they exist in. If those Osgood Schlatter symptoms have become severe or intense, clearly you'll need some local work through here. Most people do anyway. And again, you want to treat it. You want to treat the knee anyway, obviously, because why wouldn't you? You can treat the back and the knee at the same time. But whatever you can do to manage those symptoms, get your pain to settle down, whether that be sort of freeing up your quadriceps, freeing up your calves, freeing up your hamstrings, freeing up your glutes, freeing up your back, as we said, and strengthening your quads and the muscles around your knee. It's all important information, important things to do for the Osgood Schlatter disease. But as I said, if we're not addressing the hidden back components, then we're potentially failing to fix the problem. So I've got a bit of an axe to grind with this myself because as a child, as an adolescent, I loved my sport, I loved my Australian rules football, I played it a lot, And there was a 2-year period of my life where the physiotherapist in Australia told me that it's growing related, your symptoms will go away once you stop growing. And I'm sure I'm not the only person that's heard that before. But what it did for me is that it gave me this expectation that this had to be here for 2 years. She was nice enough to say that I didn't have to stop anything, but I just had to manage it. So there were days where I could play 1 or 2 weeks in a row. There were weeks where I couldn't play at all because the pain was so bad. But from what I understand now and the results that we get with our patients in the clinic, this issue, for me at least, instead of lasting 2 years, 2 months, 2 weeks, whatever the timeline is, it should have been significantly shorter because I just wasn't addressing the back dysfunction. I was doing all the strength work, I was managing it, I was taping it, I was doing all of this sort of stuff that was ultimately symptomatic treatment, and I wasn't taking the time to mobilize my back, freeing it up and then putting it in a good position. So as we talk about with every one of these videos, there's generally a symptomatic component to it. So we want to treat the knee, we want to treat those symptoms. There's also the component of why is it there in the first place? So we know that the back is potentially involved, or hopefully you're learning that the back's potentially involved, so you need to treat that. So freeing that up is important as well. The third component generally that gets missed as well is you have to try and fix the reason why it's there in the first place. So if you go hunting with a roller or a lacrosse ball and you do find a whole bunch of stiffness and tightness in this mid to low back that you didn't realize was there because of these shapes, most likely, you have to get out of these shapes. If you're an adolescent or a kid or anyone, even if you have adults, Osgood Schlatter Disease, you've got to find ways to get yourself out of that position and keep yourself there. So whether you're sitting in a chair a lot and you roll up a towel or a jumper or a sweater, and instead of you sinking into the chair, making sure that you buffer that with something like a rolled up towel so that you can't go anywhere, block that position so you just can't get into that and keep reinforcing it, because if you do, it's going to be hard for that to go away in a really smooth, timely manner in the way that you want to. So we just wanted to put that out there. I've had a lot of questions about Osgood Schlatters in the past. Hopefully it's some information that you can take with you, take to your therapist, have a play around at home, see if you can free up your symptoms, your symptomatic back or asymptomatic back, free up your thigh, free up around that area. So if you can, then hopefully you'll be pleasantly surprised that there's a lot you can do to control those symptoms and get them to go away faster. So as always, please leave a like and subscribe. We're going to produce a lot of content. Hopefully it's useful. But until next time, thanks for watching. Bye.